Welcome, everybody. It's nice to see the names scrolling in from the chat, seeing where you are dialing in to join us today. Thank you for taking the time to join us today to talk about this topic, looking at health security and resilience linked to global health and health governance. My name is Athena Madden, and I will be moderating today for the panelists who will be presenting to us today. I'm dialing in from the land of the Songhees on Turtle Island in Victoria, British Columbia, Canada, and as is our custom to do land acknowledgements, I am thankful for the stewardship for the Indigenous peoples of this lands and for their care and attention um, in grappling through issues related to global health, health governance, and human security that we'll be also discussing today. Without further ado, I'd like to introduce our first set of panelists, Dr. Roselle Roz Warner and Dr. Andy Knight. Dr. Roz joins us from Okanagan College, where she wears a number of hats, scholar and practitioner whose work bridges global health governance, human security, and equitable development. And with extensive experience across multilateral agencies and academic institutions, Dr. Warner's research examines how power, policy, and geopolitical shifts shape global health outcomes. She brings a relational and justice-oriented lens to questions of system resilience, which we'll hear about today, as well as governance reform and the ethical responsibilities of global health actors. She is also editor of the Canadian Journal of Development Studies, board member of the Canadian Environmental Network, and co-director, along with Dr. Andy Knight, also speaking with us today, of the Canadian Defense and Security Network's Global Health Security theme. I'll also introduce Dr. Knight, as Roz will need to leave us to join one of her classes at the top of the next hour. So Dr. Andy Knight is a distinguished professor of international relations in the Department of Political Science at the University of Alberta. His scholarship focuses on global governance, multilateralism, the United Nations, and peace and security, with a particular interest in how global health diplomacy and human security frameworks can be used as tools for peace. He has served on a range of international advisory bodies and has written extensively on the responsibility to protect, post-conflict peacebuilding, and emerging global risks. So I'll go ahead and pass the speaking baton to Drs. Warner and Knight, and thank you again for joining us.
Whoops. Sure. Okay. Can you give me a sense of what you're looking at? Can you see the PowerPoint?
Yeah,
Yes,
we
we
can
see your title slide. Sorry, Athena.
Oh, awesome. Thank you so much. And thank you, Athena, for putting this together. I'm calling in from the unceded and ancestral territories of the Silks Okanagan people in Kelowna, British Columbia. And I'm so happy to be here with Andy to talk about this topic of human security and global health governance, because it was something that we really started to think about the intersections between human security and global health governance, and how the dialogue between these two streams can really be a fruitful one for understanding recent events, but also understanding, the institutional basis for international governance that we have. And I think there's a lot of profound insights that can be found from global health governance for human security, and also in the other direction in terms of applying human security to global health governance. So I'll quickly just talk a little bit about the origins of human security as an idea, as a series of policy initiatives, how it changed over time in response to events, and how the big international players on the world stage both integrated it, but also pushed back against it. We'll talk a bit about the principles in health governance and how they might overlap. And then really going into how the world has changed and some of the complex systemic risks that we see, and thinking more systematically about how human security integrates global health security. I'm going to walk through some of the policy frameworks and the developments in governance, and then I'm going to turn it over to Andy to talk a little bit more about how the ethical dilemmas are illustrated through this intersection and what kind of tensions there are and what kinds of recommendations we might have for practitioners to better integrate these two paradigms. So first of all, human security came to us partly as a product of the end of the Cold War and brought a number of observations that the international community had to grapple with. First of all was that we needed to reconsider the basis of national security in military threats alone, right? So unlike traditional military threats, there were all kinds of new concerns facing the world, everything from civil wars to state-led repression, genocide, transnational crime, and all kinds of destabilizing features of the post-Cold War order that weren't necessarily anticipated by decision makers. It included threats that were persistent but not necessarily as obvious, and that pose significant risks to population, things that arose from poverty, from inequality, from environmental collapse, and weak or predatory states. So human security brought a new way of thinking that would enable an expanded understanding of what security meant, that it went beyond military threats, that included health, environment, and even political threats from the state itself. So it would include environmental, economic threats, and social risks, and a whole collection of potential threats that the state needed to take better account of, including the possibility that the state itself could pose a threat to its populations. As well, immediately following the Cold War, there was a greater emphasis on human rights and perhaps a recognition that human rights could finally begin to flourish after the end of the frozen period of the Cold War where not much was accomplished. The other thing that human security brings is an elevated role for the state and for governance. This is really despite the impression that some might think that it's an erosion of sovereignty. In many ways, human security is it's not necessarily an erosion of sovereignty, but it's challenging the basis of sovereignty. So sovereignty is understood to be conditional on responsibilities that states have as sovereign actors. So their responsibilities to their populations, their responsibilities to the populations of other states, and the necessity to take action where necessary to preserve the security, both individually and collectively. As I mentioned, it developed in the post-Cold War era, an era of increasing globalization, a sense of increased interdependence, and new global threats like the emergence of civil war as a threat to sovereignty and to national security. The human security agenda brings a few key observations that are also really relevant to global health. So the first is a shift from state-centric to people-centric security. So to understand that individuals and populations should be the new referent for security as an idea and as an action. And so this is quite a shift from the sort of traditional prevailing focus of national security agendas on military security, on protecting the state administration and the infrastructure using military means. So shifting to people-centered security has very different implications for how the state should act and how the state should understand threats. The human security agenda brought a number of legislative and international agreement innovations thinking around, for example, the responsibility to protect. In 2001, this emerged to emphasize state sovereign responsibility to protect civilians from mass atrocities. Canada was an active supporter of the activities of the International Commission on Intervention in State Sovereignty, which developed the concept in 2002. It really was a watershed moment because it moved the idea of human security and state security from being a right to being a responsibility that states had to meet. An important part of the agenda was the establishment of a global institutional mechanism to hold individuals and institutions accountable for international crimes. So the International Criminal Court was designed to address the core crimes of genocide, war crimes, ethnic cleansing, and crimes against humanity. This process also spurred the Ottawa process, leading to an international treaty restricting the production and use of landmines. And the Ottawa process included a number of health-centric provisions, including the training of medical personnel, the assistance of victims of landmines in their recovery. And as a consequence, it really illustrated the direct health security threats of the use of indiscriminate weapons like landmines. It's important to remember that the impetus for a human security approach lay in the contradictions of national security itself. So the problem that human security was designed to address was that when states try to protect their own national security, they inevitably end up undermining themselves in the long run. So, it's simple. You have a military industrial complex. So all of the things that states do to protect themselves have the effect, perhaps the unintended effect, of actually worsening their security situation. I mean, in international relations, we call this the security dilemma. And it's a well-known and well-understood feature of national security provisions. So it is something that human security is designed to address. And it does this by shifting the referent object of security, going back to protecting the individual and focusing on well-being and putting that at the as a central goal. And to focus on distributive rights and basic rights, in other words, to acknowledge that human security sits alongside human rights as one of the fundamental responsibilities that states have as sovereign actors. Increasingly, as we move through the 1990s and into the 21st century, there's an increasing awareness that we are moving into a system that is much more complex, that has systemic risks. In other words, small changes in a system can result in major repercussions throughout the system to others who are even at a great distance very often. These modern risks, of course, include things like pandemics, like climate change, and like pervasive poverty as well. Systemic risks have the feature that they are interconnected and that they have compounding effects. So just as interest compounds over time, risks are distributed unevenly across the system, and even small risks can become big threats and can emerge as emergencies if not addressed at early stages. So the international infrastructure for health security followed a similar, if kind of parallel path to that of human security. So the international health regulations went through a series of iterations in response to the outbreaks of SARS, the outbreaks of HIV, AIDS, and transmissible diseases. The major change in 2005 was to introduce changes to the international health regulations to increase state surveillance and to ensure that states were better prepared for emergencies and outbreaks. In particular, the scope of the international health regulations became an all-hazard strategy. And this is similar to what happened to human security. So kind of an expansion and a recognition that threats to security can come from a variety of different sources and different locations, that vulnerabilities are interconnected, that they're mutual, and that states have a responsibility to be more proactive in the actions that they take. The Global Health Security Agenda in 2014, in response to the outbreak of Ebola, was also a multilateral cross-sectoral agreement to integrate the World Health Organization, the FAO, and the World Organization for Animal Health. So to kind of work across the governmental and non-governmental agencies, as well as to bring in business and civil society actors in a more expansive global health security agenda. These were not without controversy, of course, especially around the tension with national security, and to what degree should health integrate narrow security threats versus wider security threats. So the tendency for the international community to be hyper-focused on emergent transmissible diseases was really evident here. And a lot of these governance innovations came in response to these emergencies. One of the things that human security had been saying for quite some time is that emergencies don't emerge in a vacuum, right? So if we think in terms of proactively, think in terms of the international system as being more like an iceberg. When emergencies emerge, they're usually a result of long-term underlying changes that are happening, and that states need to be aware and prepared for those as much as they do for emerging threats like transmissible diseases. The United Nations Sustainable Development Goals brought forward another leap in understanding of health. In 2015, 193 countries adopted the SDGs for 2030 to achieve a more equitable, healthy, and prosperous world. The SDGs, of course, are much wider than the Global Health Security Agenda, but there are a lot of synergies between the two. The Global Health Security Agenda advances health security by building sustainable societies. The SDGs promote human security. So the SDGs are really important in bringing together these two concepts. In 2015, Ilona Kickbush called for an additional SDG, SDG 18, that would recognize global health security as an important standalone component of the post-2015 development agenda. Likely, this will re-emerge as we move closer to 2030 and a re-examination of the 17 Sustainable Development Goals to better understand whether new goals are needed, whether they need to be reformulated, and what those might be moving forward. So I've done a little bit of a historical overview and thought about ways that human security and global health security have synergies, the way in which they work together through these international agreements. This has been a very quick overview, I realize, but I'm happy to turn it over to my colleague, Andy Knight, who will say a little bit more about recent developments, as well as what we might do in terms of reform and change to the international system to better address these gaps.
Thank you very much, Rosalind. That was a very impressive and comprehensive overview, I think. Doesn't leave very much for me to talk about, but I think it's important that we can continue this discussion. First of all, I wanted to say that, first of all, thank the organizers for including us in this very important session. I think the whole issue of the expanded nature of security is something that we all recognize is very important at this particular moment in our history. I always like to talk about the interregnum because I think this is something I've been working on for quite some time now. The notion that we're shifting from one world order to the next, and that within this period of time, this interregnum, we are witnessing all sorts of challenges, turbulence and flux and within the international system, and the health issue is also going through the same sort of turbulence and flux. I think the pandemic recently demonstrated to us the importance of trying to understand the complexity, what Rosalind talks about, this notion of complex interdependence of issues. And so I want to continue from that point of view. First of all, human security is really in a sort of what I call a polycrisis era, which is replicating the sort of the turbulence and flux of the interregnum. Um, we are working, Rosalind and I, we're working on a volume, edited volume called The Politics of Global Health Security Governance. And I think that book is going to really try to expand on what we are talking about here today. Um, the the framing of the problem really starts with systemic risk convergence. Um, you know, Rosalind has already laid out the whole interconnected nature of the systemic risks that we face. Global health practitioners now operate within what the UNDP has called an uncertain complexity. Cities are not isolated shocks, are not isolated from shocks within the international system, but systematically entangled with things like climate-driven outbreaks, conflict-disrupted health systems, economic turbulence undermining well-being, and traditional disease-specific or national security paradigms are no longer sufficient to explain this situation. And that's one of the reasons why I think, as Rosalind points out, human security as a paradigm is very important because we're shifting away from protecting the nation state per se and protecting the people that live within the nation state. We are trying to empower people to address the security concerns and the threats that people face from all these complex threats. Human security, therefore, reframes health as a foundational concept, right, to dignity, agency, and survival. Lloyd Asworthy, I think, was one of the first people to acknowledge this when he was Foreign Minister of Canada, when he argued that human security puts people first. And that was a real interesting mantra that he had said over and over again. We need to put people first when it comes to security. The state is a very interesting complex, but the state itself is almost like a figment of our imagination more than anything else. The reality is the people within the state are what's important, and we therefore need to put people first. And this is essential when threats are particularly intermestic. And that means that threats are no longer limited to those threats that are either outside of the state or those threats that are within the state. There's a sort of intersection of the international and the domestic when it comes to addressing security threats today. And health security is not just about pathogens, it's not just about conditions that shape vulnerability. It's also, as the book that we're trying to publish right now, is about living in a very multiplex world where governance is fragmented across various sectors, across evolving power centers, and global health risks are systemic, not episodic. Effective governance therefore requires anticipatory, adaptive, and inclusive framework. And I think that's what Rosalind is hinting about when she talks about the reform of the United Nations, for example, to address these threats. We can no longer depend on the outdated structures that have been put in place in 1945 to deal with some of these new and emerging threats. We have to be innovative. We have to adapt. We have to change. And I've written a couple of books that deal with UN security adaptation, UN institutional adaptation to security problems, adapting the United Nations to a postmodern era, for example, or changing the United Nations, two books that I've written. But I think this particular book is going to focus on the problems and the challenges that we saw emerging out of COVID-19, for example. The global political realignments that have taken place as major powers are starting to emerge. China is one of these countries that are trying to emerge and changing the governance norms. Human security lens therefore reveals shifting of global power dynamics as well. And talking about China, I think China's expanding presence in the World Health Organization is an example of how we need to take in consideration emerging powers in this very different world in which we live. The multi levels of governance, the multiplex world, as my colleague in American University talks about, the multiplex world where governance is fragmented across different power centers is also included in this notion of emerging powers that are taken over from countries that are falling. Let's put it that way. There's a shift in the structure of world order, and China is one of those countries that are trying to take up the space that's being left from, say, the United States lack of leadership in this area. So I think the vaccine diplomacy that we witnessed during COVID-19 showed to us how health, soft power, and security can intersect. And it raises questions about whose norms will shape global health governance in the next decade. And this is the sort of futuristic nature of this book that we are trying to publish here, because it deals with not just the need for reform of the UN system, but the need to reform the entire global health governance system that may include the UN, but not limited to the UN system. So the case studies in the book, I thought we should raise some of those case studies just to give you an example of what we were trying to do with this book. We talked about Africa, the Caribbean, and in fact, the global perspectives in the book. And from the point of view of Africa, we see how the African Union health strategy integrates human well-being and health security imperatives. Of course, they're drawing very heavily on what Canada has done with the International Commission on Intervention and State Sovereignty, but also what Canada has done in terms of promoting the notion of putting people first. There's an importance now of regional cooperation after COVID-19. The need for regional cooperation is very, very essential here. And that's one of the reasons why we included in the book examples from the Caribbean. CARFA, for example, had a coordinated response to COVID-19 as a model for intergovernmental solidarity. We have had integrated NCD responses during the pandemic. And from the point of view of global institutions, we've seen military medical perspectives on early warning, ethical and political implications for border closures as an example of what can be done. I want finally to talk about the intermestic nature of security and why national approaches are failing right now in this interdependent world. Um, Health risks in 2025 are obviously interdependent. No state can manage the antimicrobial or resistance or the zoonotics that we've seen, the zoonotic spillover, or the cyber attacks on hospitals or climate-induced outbreaks alone. National security frameworks cannot manage these globally networked risks. And therefore, human security then becomes a very good conceptual bridge linking state responsibility with global interdependence. And so the need for new global governance mechanisms, especially in the area of health, having one health, one planet health and complexity science is very important. Um, we need to expand the unit of analysis. Health of people are very important, but also health of animals, the ecosystem of animals and peoples are intertwined in a very significant way, and that needs to be taken into consideration. Complexity science also involves health systems that are complex, adaptive systems requiring flexibility, requiring network governance, not rigid hierarchies. We cannot live in these silos that we used to live in the past. Now we have to deal with these network governance hierarchy structures. and not hierarchical structures. And these innovations, I think, align with human security's call for anticipatory and multi-sectoral governance. So human security as a guide to policy designs would include three functions, I think. One, to diagnose the structural vulnerabilities that we face. And Rosalind pointed out some of those structural vulnerabilities that we face, including inequities, poverty, marginalization, governance gaps, etc. And also, secondly, to integrate security, development, peace building, and public health. And the third is to transform systems towards resilience, equity, and adaptability. I think if we bring in examples like vaccine nationalism, inequitable IP regimes, humanitarian crises, etc., you can see how human security can highlight the distribution of risk and can call for ethical approach to governance. So what we're left with really is a number of recommendations, or are a number of recommendations in the book. One dealing with multi-level coordination, the need to coordinate local, national, regional, and global approaches to health security. The second is inclusive governance. So communities have to be involved, civil society, marginalized populations. And third is distributed capacities, so regional manufacturing, surveillance, digital health, etc. Anticipatory models can also scan emerging systemic threats. And it's important for us to emphasize resiliency as important, is an adaptive capability that's necessary and not just capacity building. So I'm going to leave it there, but I think the important takeaways I think you can take from our presentation today is that human security really clarifies the root causes of vulnerabilities, really shifts the debate about what is security and who is security for, who is being secured. Secondly, is the systemic risks require systemic responses. Thirdly, governance must be anticipatory, must be inclusive, and must be adaptive. We have to take in consideration all peoples at every level in order to be able to address this issue of global human security. And then the polycrisis in which we live, the polycrisis era, this particular period of time where there's shifts from state-centric to people-centric governance is extremely important. And I think our book offers conceptual tools and policy pathways for this kind of transformation that's necessary. So I'm going to leave it there, but I hope you get a picture of what we're trying to do with the book. And I think it really sort of applies to what you're trying to do in this particular conference this week. Thank you very much for having me.
Thank you, Andy. Thank you, Roz. We now have some time before Roz needs to hop off to her class, but Andy will continue to join us. For this particular session, it would be fruitful, I think, to have questions following the speakers. So I'd like to, I think, Andy, you gave us three particular themes that we can piggyback and ask questions off of. So for those of you in attendance, please feel free to pop your questions in the chat. We can answer them alongside. I'm just curious to know, I can also have some questions here. You mentioned a number of things for complexity science and adaptive management, your wealth of experience looking at how the United Nations framework ought to or could consider changing to accommodate the crisis or the polycrisis within which we now live. So I'm wondering, and perhaps I do see a chat that's popped up from Caitlin Bradburn. I'm wondering if, following her question, if you might be able to comment on how the United Nations could better address issues of global health within its framework. We did mention, or Roz did mention, that the SDGs is broader than health and human security, but it hasn't fully been leveraged to address this particular, the particular dimensions you discuss. So I'm curious about that in the back of my mind. Having said that, I prefer to give deference to the questions for people who are attending. So Caitlin, thank you for typing your question in the chat. Is there an example of human security done right on a large scale? For example, a country doing it well or on a massive program?
Mm-hmm.
Thank you for that.
Roz, you want to start? Because I know you have to leave pretty soon, so I'll give you the opportunity to start off.
I mean, I'm tempted to say that the answers are already there in the UN Charter. I mean, there's lots of options for intervention to address situations before they arise, and but of course, the United Nations is a function of the states that belong to it, and unless that is addressed, unless that fundamental disjuncture is addressed, ordinary people will become more and more vulnerable, as well to what states themselves do. Now, Andy is the expert on the UN, so I'm gonna turn that over to him. As far as examples of human security done right, I absolutely love this question, and I think it's something that um, needs to be researched a lot more. And again, I think very often the answers are there. I mean, one of the things that I've looked at in the past are disaster responses, and people to people on the ground disaster responses when situations arise, I think is one of the ways that human security is done right. It is perhaps reactive, but when we have good infrastructure in place to respond to disasters well and quickly, we can develop the conditions that are going to be needed to address the next disaster. So it's not just a reactive thing. I think that the infrastructure for disaster response contains a lot of wisdom, and the Sendai framework contains a lot of wisdom about how to address that more fully.
Yeah, and if I can continue from there, I mean, I think, first of all, I think Roz is right about the importance of prevention, for example. That's something that is built into a lot of what the UN has been trying to do. Bear in mind that one of the challenges that we have with the UN system is that we have a Security Council that's really outdated in terms of its inability to represent the world. Let's face it that way. The power structures have changed over time, but we haven't seen very much change within the UN Security Council. And that's difficult because it's almost impossible to reform the UN Security Council to deal with these kinds of complex uh, human challenges to security. And the reason for that is that there is a provision, obviously, within the UN Security Council that allows for the use of the veto system. The veto was intended to make sure that the big powers can stay within the UN system, not work outside of the parameters of the UN. And while that was a good intention, what it's done is that it's forced us many times not to be able to bring forward preventive measures to deal with human security challenges, because one of the big powers, it could be one of the big five, permanent five members, decides to veto that particular provision or resolution. So we saw this in the case of Myanmar, for example. You know, the difficulties of trying to deal with human security in Myanmar had a lot to do with the fact that China just did not want to have that on the table at the Security Council, and therefore vetoed any possibility of using that. We've seen it happen with the United States vetoing certain issues. We've seen it with Russia vetoing certain issues. So the challenge is really for us to find a way to get around this very rigid structure of the UN Security Council to try to adapt that system to accommodate a changing world. And unfortunately, I think we are at a real serious crossroads in which the intent of the UN Charter is not being fully exploited because of these limitations and these barriers that are placed within the Security Council, but also sometimes within the General Assembly. Because some people might criticize the General Assembly being the talking point, talking position rather than acting and implementing on certain policies that the UN ought to be implementing. So I think these are some of the issues, but I think some of the examples of where we saw human security having the potential to be being done right, as that person points out in the piece, is in the area of DDR, disarmament, demobilization, and reintegration. The UN does have a fairly robust DDR structure now that's put in place in post-conflict settings to try to address human security challenges, to try to rehabilitate people who have been at war with one another, to reconcile individuals that have been at war. And I think that's one example of what's possible. I'm not saying that it's not necessarily um, uh, efficient and effective, as efficient and effective as we would like it, but I think it's a really good sign of moving forward to bring in some sort of preventive measures, or at least deal with tragedies that have occurred in the past, in attempts to try to correct those tragedies, to reconcile individuals, to rehabilitate them in some form. Rehabilitation is a very important part of what we're talking about here when it comes to human security, when it comes to global health. Rehabilitation is extremely important. We have to find a way to bring people who have been torn apart by conflicts, to bring them, make them, relevant to the society again, to be part and parcel of the society again. So I'm going to leave it there, but I hope that sort of answers some of the questions that were just posed.
Thank you, Andy, and thank you, Ross. We have one question coming in from Ashok Patel. How do we balance or develop rapid countermeasures for people first versus profit first?
Yeah. That's a very tricky question, right?
Yeah.
Start on that one. I can continue where you left off.
I would just say that one of the things that I've encountered through looking at the relationship between human security and health security is the idea of empowerment. And I think there are a number of questions as well about trust in the chat. So trust is restored between people when they feel that they have the capacity and the ability to realize their highest potential. And so, that capacity building is related to the social trust that we develop alongside it. That's 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 the extent of my reflections, perhaps. And
If
rapid response, takes trust first, right?
Mm.
For people to want to do something, to want to respond, it takes that trust has to be established first, and that doesn't unfortunately happen rapidly.
Mhm.
If I may, Ashok has also written along, just piggybacking off of what you were just suggesting, Roz. He mentions also as a practicing physician and advocate in training via AMA and UN World Info Transfer. How do we transcend or co-evolve diverse approaches to whole person healing along with data storytelling? Kind of alongside what you were just saying. Your recommendations for restoring that trust and respect for systems and social science is most appreciated. So thank you. I will ask to the next question in the order that we did receive them. This is from CZ Bevis. Sorry if I mispronounced your name. Question regarding animal health rights. The sentence was left without more detail. Can you explain more, please? Are you talking about all animals or just domestic pets? Thank you. And then I will also just add the second question from Sylvia Calendar Carter, a name I recognize with the Education Committee. Nice to see you. With the current distrust of the state and how do we propose best practices? These kind of all piggyback also to the theme of trust that you just mentioned.
Well, in the first question about animal rights, I'm talking about all animals. I'm talking about all living creatures. In some ways, there's an intersection between all living creatures. We can't pretend as though we are the only ones that are on the planet. I mean, we have to intersect, and we have to sometimes live with other species. So it's more a case of all living species that we're talking about, and how do you account for that in any sort of paradigm that deals with global health? Human beings have to interact with animals, and with other species as well. So it's really about that rather than simply looking at pets or certain types of domestic pets. I mean, that's part of it, but that's not the whole picture. And what was the second question again? I think.
Yes, this is from how do we, sorry about that, I just lost my place. How, with the current distrust of the state and how do we propose best practices, which actually links to Fayo's question in the Q&A chat, how to overcome the inherited shortfall of global institutions responsible for enforcing human security laws, as they can't override government powers, especially against crimes against their populations or within their own territories.
Mhm, mhm. Speaking about this from a sort of UN perspective, because I think, the United Nations really is an institution that is comprised of states, primarily, right? It's still, we try to talk about we the people, then we talk about the United Nations, but in fact, it's really about meeting the needs of individual nation states that are members of the United Nations. And people seem to be sometimes put on the side burner when it comes to this, except maybe in the areas of human rights. I mean, human rights, I think that was an attempt to bring in individuals, right, into the paradigm. The advancements of women's rights, for example, does another attempt to bring individuals in, but states usually tend to override what happens. I think the responsibility to protect norm, which is something that I've written a lot about, and Rosalind pointed out in her presentation, is one example of where we try to make some progress in this area. It really is about putting people first. I mean, the very fact that the International Commission on Intervention in State Sovereignty was behind this proposal to the United Nations, and in 2005, of course, all member states of the United Nations signed on to the idea of responsibility to protect. But here's the problem. There's one thing to sign on to a proposition, to sign on to a new norm of international relations. Is another thing to ratify those norms. We have to be able to bring those signatories, right, and what they have signed on to the national parliaments and make sure the national parliaments can ratify these things to make it into truly acceptable international law. We call it cascading of the norm. The cascading of the norm is what we're having some difficulties with right now. So this is just not only for R2P, but also in the other areas as well. When there are good proposals to deal with health security challenges, and sometimes what happens is that well-meaning people, they meet at COPs meetings, they meet at the United Nations General Assembly, they sign on to these initiatives, they make pledges and so on. But then back home, they have to be able to convince their population that this is the way to go. And sometimes that next step is not done. So we need to be able to work on that in order to be able to improve any sort of policy when it comes to human security or global health security.
Thank you.
Yeah.
Roz, I think that I know that you mentioned you have to go by the top of the hour, and I think we've got 3 questions left, which can probably conclude this session. So hopefully we can get some of your thoughts before you have to hop off. One is coming from Radhika Tabras, and again, apologies if I mispronounce your name. Thank you for your question. Radhika saying, wondering how the recent UK COVID-19 inquiry report that calls the COVID response, quote, too little, too late, end quote, would inform your work, and how can future global health frameworks proactively address such governance failures? I'll leave that, and then we have 2 more.
Okay.
I would just quickly say there's a role for global health diplomacy, and building trust is actually something that diplomacy is surprisingly good at. And if we had more expertise, more people who were specifically trained and oriented and deliberately and intentionally focused on global health diplomacy, I think a lot of these questions would be better addressed. Sorry, I don't have time to delve into your questions, but I'm happy to get anyone who wants to email me and talk further. I put my email up earlier and happy to continue the conversation. Thank you so much.
Thank you, Roz. I'll also put your email in the chat for future attendees, and some people have already mentioned that they will be in touch over email. Thank you for your contributions today, and we'll see you next time. Andy, we have one more question. This is from our esteemed Dr. Keith Martin, Executive Director for CUGH. Thank you for being with us today, Keith. The undermining of international structures are political choices. Those engaged in these efforts benefit from these actions. What are the political arguments and partnerships that will affect the changes that will create an effective enforcement mechanism?
Mm-hmm. That's a very big question, and probably need another session in order to answer that question. But this is all about reform, and I think we have to move beyond the narrative of reform, to be quite honest, because reform has limited parameters, right? When you reform something, you're trying to just to oil the wheel, the squeaky wheel. You're trying to oil the squeaky door or something. That's the nature of reform. It doesn't really tackle the issue of relevance. And I think trying to make an institution more efficient and effective is one thing, but trying to make the institution relevant to a given change in transformation within the society is a completely different thing. I think we have to move beyond reform and move towards transformation that requires learning. Individual institutions have to learn how to move from one status to another, and that requires a different kind of momentum, right? You have to be able to transform rather than simply reform. I've been pushing this notion for a very long time, and I don't think I've gotten very far when it comes to convincing the United Nations, for example, that they need to sort of stop this perpetual decade by decade reform efforts. Because if you look back and see from 1945 to the present, we have almost every decade there's another kind of reform, the group of 18 reforms. There's several different types of reform efforts, and we haven't seen very much, except for maybe small areas of efficiencies and effectiveness. We haven't seen the transformation that's necessary for a world that's undergoing a shift from one world order to the next. 1945, the world order that was created around that time, that included the International Monetary Fund, the World Bank, international development agencies, etc., that was okay for that time. We're living in a completely different period now, where the actors are different. The actors of importance are different. The influx of new states that came into the system within the United Nations system, a lot more colonized states came into the system that weren't part of the creation of the United Nations system in the first place in 1945. These are new states that got their independence and came into the system. We haven't really brought them to the table to make the kinds of decisions that are necessary for them at the global level. And I think this is important now. We have to bring the marginalized countries that have been left out, that have been marginalized, bring them to the table and let them help to make the decisions that are necessary for a transformed world. And I think that's our challenge right now.
Thank you, Andy. I think that wraps up this first set of panelists, and thank you for your time and expertise and for the participation of the panel, or for participation for people answering questions in the chat box. I would like to now move on to presenting our next panelist, Dr. Sarah Bano, who comes to us from Thompson Rivers University. There we go. Sorry about that. I just had a question pop up. Sarah's research focuses on international relations theory, great power politics, following along with what we were just discussing, and security issues in South Asia. Her work examines how shifting geopolitical dynamics, including regional rivalries, economic interdependence, and global governance tensions shape both state behavior and the vulnerabilities experienced by populations. She brings a global security lens that enriches discussions of structural risk and its implications for health. So, Sarah, I would like to turn the speaking baton over to you. And we did have a question in the chat box with respect to transcription, live integration transcription. So I'm just wondering if Elizabeth, I'm assuming the session being recorded offers that opportunity for reference later, but I don't know if people would like to have transcriptions live as we speak.
I can just jump in to say that if you want to see the transcription on your screen, you can click where it says show captions on the bottom.
Thank you. All right, Sarah, passing the baton over to you, and we can see your slides.
Oh, I'm so sorry. Thank you so much first for having me. You can't see my slides?
Oh, now you can just see my face, but previously we were able to see your slides. Thank you. Perfect.
Oh, it's visible now?
It's great. Thank you. And thanks, Elizabeth, for that clarification.
All right. Thank you so very much for having me on this panel. Thank you, Athena, for organizing all this. And I'm so glad I'm after Rosalind and Andy, because they have eloquently laid out all the conceptual work there. That why it is really important to have a human security lens in global health governance. And they have eloquently laid out that how this human security has evolved with passage of time. And I loved how Rosalind and Andy, they emphasized that this human security framework is not going to weaken state sovereignty, rather than it's going to strengthen state security. And this is what I'm going to talk about in case of South Asia, that how sticking on to this traditional security is questioning states' legitimacy, and we are having more political instability or conflict in the region. As Andy pointed out, that we are having this, he called it polycrisis. So I'm going to call it as a syndemic insecurity. It means that we are having these multiple conflicts there, multiple issues there, and they feed on each other. They aggravate each of this issue. This is, I'm going to call it syndemic insecurity that we are witnessing in South Asia. What I'm going to talk about is how we need to have this human security lens in health security, in particularly in case of South Asia, and then how conflict and climate change, they are aggravating health insecurity in South Asia. And then I'm going to talk about little bit about this endemic insecurity, and I'm going to talk about how this climate change is a threat multiplier in South Asia. It is not only aggravating this health insecurity, but at the same time, we are having economic volatility there, and it is putting way more pressure on this health security infrastructure that is already weakened and that is already fragile. Then we are going to talk about, I'm going to talk about how this human security, it leads to political instability. In South Asia, it is weak health security is not only symptom of this weak development issue, but at the same time, it is driver of political instability there. Then we are going to talk about how human security, I'm going to talk about how this health security can be used as a useful mechanism to have confidence building measures among South Asian states, and what challenges we are facing it. In the end, I'm just going to link this regional security to this global security. What we are looking at global level is also mirroring at regional level in South Asia. As Andy and Rosalind mentioned, that traditional security is incapable to deal with global health threats. We are having multiple threats. We are having climate shocks. We are having violent conflict, economic volatility, and population displacement. It means that the traditional state security or traditional health security framework is no longer applicable. If we look at pandemics, food insecurity, supply chain disruption, cross-border pollution, they expose populations to insecurity that transcends borders. It means that we need to move towards this collective security. We need to have this human security lens that prioritizes the protection and empowerment of people rather than states. And if we look at South Asia, in South Asia, we are having this, for example, in Pakistan, we are having this climate induced floods, heat waves in India, political instability in in Afghanistan, economic crisis, and yesterday we had cyclone in Sri Lanka that killed hundreds of people. 400 people are died. 300 are missing, 20,000 are being displaced. So this reveals how these threats are intertwined. They are interrelated, and it is undermining the already fragile health system there, and it is threatening population's well-being. So what we need to do, we need to have this human security lens in South Asia, where we are going to look at that. We need to have comprehensive, we need to have collective security concept in order to deal all these interrelated issues. If we look at this climate change is a threat multiplied there, and South Asian region is one of the most vulnerable to climate change. Here, Bangladesh and Maldives, they are facing sea level rise. What we have seen there, that frequent floods, droughts, glacier meltdown. It is also it is becoming new normal there. That every year, India and Pakistan, they are facing this flood issue because of this monsoon irregular patterns there. If we look at this conflict and political instability, as we know that in Afghanistan was grappling with this civil war for such a long time. Now Taliban's came into power, and now Taliban's are restricting healthcare system, where we know that women are not free to practice in healthcare system. And it is aggravating this weak healthcare system there. In Pakistan, we are having not only traditional security problems, enduring rivalry between India and Pakistan, but at the same time, Pakistan, for example, had worse flooding in 2022, which affected 33 million people there, and the infrastructure damage was $15.2 billion there. In India, we are having this extreme heat waves there. There are deadly heat waves there. In Sri Lanka, they were having a long civil war there, and after that, they faced economic bankruptcy there, and it is aggravating their human security and especially their health security mechanism. In Bangladesh, that is considered as the most densely populated country in the world, is also at the verge of this cyclones and rising sea level. So this climate change is considered as a force multiplier, it's threat multiplier that intensifies existing challenges. And this leads to this endemic insecurity. And endemic insecurity is when you have the convergence of conflict, poverty, environmental disasters. They create a syndemic, that it means that these issues are interconnected and they feed on one another. So health security is not only challenge to a development issue, but it is also driver of political instability there. When people are not getting healthcare system, it means that it weakens states' legitimacy, and your country is more at the risk of political instability there. So this is, I want to talk about this endemic insecurity in South Asia, where all these crises are interconnected and they are amplifying each other. We have this climate, conflict, disease, and they escalate this fragility there. Well, for example, if there is flood in Pakistan, it aggravates health insecurity, because then after flooding, there is this waterborne diseases are there. And then it has economic aspect as well, where you are going to have damage of infrastructure, loss of crops, which leads to inflation, and there is risk of social unrest there. If we look at South Asia, so South Asia is one of the most vulnerable region to health security, to human security and climate change. 9 out of world's 10 most populated cities are in South Asia. So you imagine that the cities are most populated, and 9 out of 10 are in South Asia. And this pollution has decreased your life expectancy. It has decreased your life expectancy in the region by about 3 years. And in the worst affected areas, it has decreased life expectancy by over 8 years. We are having this extreme weather there, and which is going to have huge impact on population. For example, the data suggests that more than half of region's population, that is roughly 750 million people, they experience at least one natural disasters over the past decades. So this is hugely populated area, with, of course, India being the most populous country in the world. So people are vulnerable to these recurring floods, storms, and droughts. So this has become new normal there. Like every year, they are facing these natural disasters there, heat waves, and these are documented deadly heat waves, and it is especially threatening for vulnerable communities, which are in informal houses or outdoor workers. So health impact, whether it's air pollution, climate extremes, environmental stress, contribute to chronic health problems. And we do see undernutrition there, respiratory, waterborne diseases there, low birth rate, increased mortality among children and women. And it is not only putting extra burden on this already weakened security health security system, but at the same time, it is having massive economic and social cost. For example, this is worst flood in Pakistan in 2022, where one third of country was submerged, and it resulted in damages estimated about 15.2 billion. So you can see how it translates into economic instability and social crisis. Um, then if you are having climate change, worst effects of climate change, it means that it aggravates your food insecurity. Um, as we know that South Asia, most of South Asian countries, they are agrarian economies. It means that they rely on their crops, and these crops, they depend on monsoon season, which is rainy season there. Due to climate change, we have that disruptions in that monsoon season patterns, which damages crops and raises food prices, and it leads to food insecurity there. Due to these floods, heat waves, coastal erosions, millions of people are relocating there, and that is creating stress on resources. And that leads to resource-based conflict. Whether it's water, land, or energy, it intensifies tensions between communities, and this is another driver of political instability there. It amplifies weak institutions. We know that governance system is already weak there, and it's been plagued with corruption, poor infrastructure, weak coordination among federal and other institutions, provincial institutions. So that limits states' capacity to deal with these issues. If we uh, and this is what Andy and Rosalinda's point is, that it is human security is not going to weaken state sovereignty, rather it strengthens state sovereignty. If your population is vulnerable to all these issues related to human security, it means that it weakens a state's legitimacy. And if state is failing to provide all these basic necessities of life, it means that people are losing trust to these governments, to these institutions, and you are at the verge of this ticking bomb that can explode anytime. This is what we have seen recently in Nepal, that people came out, and that happened in Bangladesh as well, that people came out, and due to these protests, there was change of government there. So this political instability becomes features where human security is not being addressed properly. And when state system is weakened, it means that it provides opportunities for non-state actors to come in and fill that gap. Whether it's extreme religious organizations or other extremist groups, they can fill that gap, and they can further challenge state sovereignty there. So health security is not just a developmental issue. Health security is also a security issue. It is a state security issue, and this is where I'm reinforcing Rosalind and Andy's point, is that the human security, the perception about human security is that it is against state security. It is weakening state sovereignty. Rather, it is strengthening state sovereignty, and we need to focus more from traditional security to human security, because if your population is having human security, it means that you have better legitimacy and control over at the state level framework. So if we look at, so as we know that in South Asia and in India and Pakistan, they have enduring rivalry there. Both countries, they went multiple times to war. Recently in May, both went to this conflict where military conflict escalated before they called ceasefire. So they are having this enduring rivalry there, but health diplomacy can serve as a confidence building measure. But we have seen that health can play a role of bridge for peace and cooperation in the region. This is where what we have seen that India and Pakistan both are interested in polio eradication efforts. If virus is still alive in one part of the border, it means the other part of the border cannot be saved, cannot be secured, or the efforts to eradicate this virus are not going to be effective one. What we have seen that India and Pakistan both they collaborated with each other along this polio eradication efforts. In 2005, so Pakistani occupied Kashmir had this deadly earthquake. And at that time, both countries, India and Pakistan, they put their political and military differences aside, and they opened their borders for humanitarian assistance. And then recently, during this COVID-19, both countries, especially SAARC organization, that is South Asian Association for Regional Cooperation, SAARC, they opened this COVID-19 emergency fund. So these are examples that can tell us that it can serve as a confidence building measures. And what we need to do, we need to apply this collective security idea in health diplomacy and in human security. If we look at health collective security mechanism in state security or traditional security, we have this attack on one is considered as attack on all. But if we need to apply this concept into health sector, because a disease outbreak anywhere threatens everyone. It means that we need to look at this from this collective security perspective, where if there is a disease outbreak, states are required, they are under obligation to share their data, and do not mess up with the data, do not politicize that data. And then regional early warning mechanism should be in place. And if there is disease outbreak, it means that all states at the regional level and global level, they need to have this joint vaccine and medical procurement. So what we are missing here, it's not the capacity. We have regional organization in place in South Asia, that is SAARC. We have capacity, we have infrastructure there, but what we are missing is that trust, that states do not trust each other. There is where they are concerned that if they are going to share data, that can be politicized, that can be used against their national security interest. So we are having this trust deficit there. It's sometimes what we do that, so South Asia is an interesting place where they are having South Asia is considered as a venue for great power competition. Here, China is in South Asia. China is trying to increase its influence there, and India, with support of US, is trying to increase its influence there. So when they are having, whether it's India or China, they are having this humanitarian aid in the region. This is a politicization of humanitarian aid. If they are providing human security human security aid in the region, this is done from the perspective that they are going to increase their influence in the respective countries. So here, what we have seen that SAARC is being practically paralyzed in South Asia due to the rivalry between India and Pakistan there. SAARC is not being able to play that important role there, which it should be playing. There is this disinformation there where states are concerned not to have cooperation on these non-political issues because of the concern of spillover in their political or military issues or strategic issues. For example, during this COVID-19, here India was trying to have this vaccine diplomacy. They are trying to get influence in South Asian countries, and China, on the other hand, was countering it with its own digital health Silk Road initiatives and all that medical equipment and vaccine issues. So they were doing, rather than having these collective coordinated efforts, what they were doing it, they were trying to provide this aid in contour to each other. So the region, what we do see is just mirrors what we do see at global level. In global level, WHO couldn't play that important role because instead of WHO become a platform, a venue where both US and China, they are going to have coordinated and collective responses, it became a venue for this geopolitics between these two major powers. And this is exactly the trend we are seeing in South Asia, where India and China, they are trying to get influence, and they are trying to trying to make alliances and counter alliances, and they are using this humanitarian aid as a way of influence in South Asia. So the smaller South Asian countries, they are having hard time to keep a balance between these two Asian giants. Um, so just like health security, that shows us, it is mirror of what global order we are going on. And this is where Rob is going to talk more about this, how China is filling that gap when US is retreating. So what impact we are going to have, what emerging norms we are going to have if China is having more influence in the global governance system there. We do see that global order is more of a multipolar world, where we do see that there are different centers of power there, and how they are influencing this global infrastructure. Uh, in case of health security, in case of human security, and this is exactly what we mirror at the region level, where traditional security is still playing an important role in the region. And for example, in May, India and Pakistan, they went to this short war, and after that, Pakistan increased 20% of its defense budget, which is already humongous defense budget. It means that you are not putting resources in developmental issues. Um, so it is interesting to see that more people are being killed, more infrastructure damage is happening due to this yearly flooding because of irregular monsoon season. But we are putting more resources in traditional security, and that is already putting pressure on weak developmental infrastructure in the country. So the point I'm trying to make is that human security is state security. State is going to have more legitimacy and authority if human security is integrated in state security. So whether it's conflict, climate, diseases, they make this syndemic loop. Um, Health insecurity accelerates governance breakdown and regional instability there. Um, Due to trust issues, we haven't been able to to use health diplomacy as a confidence building measures among these South Asian states. But what we really need is that we need to have this understanding that the future of South Asian stability will depend less on missiles and tanks, but it is going to depend more on building resilient societies and putting more resources in human security issues. Thank you so much.
Thank you, Sarah, for that comprehensive overview, and also linking into Sarah and Roz and Andy's presentation, and linking also to Rob's, which will follow. We do have one question that has popped into the chat box for your presentation. With global warming and social instability being unpredictable, what are the ways in which people can prepare for these situations, recognizing it varies from one situation to another?
So that's a really good question. It is where, so one of the trend is that if we are having all these interlinked issues, we need to go back to these, indigenous ways, and we to learn from them that we need to have indigenization, knowledge of indigenization, where we need to learn that how we have been tackling these issues there. Climate change is aggravating, but it has been here for a long time. So we need to learn from them. This is how people can coordinate with each other, and they can rely on these local knowledge, because they know the region, they know the situation, and they are in the best situation to apply all these time tested strategies there. At the same time, I think civil sector needs to step up in that, where we are having all these NGOs working in environmental issues. For example, in Afghanistan, what we have seen that uh, that this government there is not being recognized by many countries. But what international community is doing is helping them through NGOs. All these civil sector is there in order to help them go through all these natural disasters there. We had a flood recently and earthquake in Afghanistan, and it was civil sector that was playing an important role, and they were serving as a channel from international community to local level to get the aid flowing there.
Thank you for those examples. We have another question from Radhika. With California's wildfires, increasingly destructive US hurricanes, and unprecedented fire seasons in Europe dominating global attention, is it right to worry that South Asia's climate-driven health crises will be sidelined? And what kind of South Asia-led health diplomacy is needed to prevent that?
So this is another issue about this climate change, is that it's all interrelated. That if there is something happening in one part of the world, it is going to have an impact on another part of the world. If ice is melting in Arctic, it is going to have impact in South Asia as well. So this all this global interrelated issue, what we do see. First, one thing that is being worried is that usually US was playing this role of leadership in terms of climate change. But with Trump administration in power, we do see the US is no longer interested in that. Rather, when President Trump, he goes into United Nations General Assembly address, he categorically condemns this climate change and calls it a scam, green energy scam, and all these things. So that leadership is there, and this is where Rob is going to talk about how China is filling that leadership gap there. In terms of South Asia, how we can use health diplomacy is there, that we need to revitalize SARC. SARC has been, the regional organization has been hostage to this conflict between India and Pakistan. We need to have data sharing there. We need to have collective mechanism. We have center of data sharing in SARC, but states are not utilizing it because of their security concerns and because of mistrust among them. So SARC needs to play an important role, where they are going to have this. We are getting flood every season, every year, and we need to have more data sharing there. We need to come up with this more collective research projects there, where we can predict these things. All these issues that we are having is more of a reactory one. So whenever there is flood, in a reaction, we do all these stuffs, but that stuff is gone. Even though we had this health diplomacy where both states collaborated on a couple of occasions, but that was on ad hoc basis. It was not institutionalized one. So we need to have institutionalization of these collaborative efforts, so that even if there is political relations are not good, these mechanisms, these institutions, they are being isolated from this political heat.
Thank you very much. That actually segues quite nicely. We are at time to segue into Dr. Hanlon's portion of today's panel. So thank you, Sarah, for that presentation and for your guidance. I'd like to now introduce Dr. Robert Hanlon, who comes to us from also Thompson Rivers University, where he's an associate professor whose research explores human security, governance, and corporate responsibility in the Asia-Pacific region. His work focuses on how corruption, weak institutions, and transnational economic forces contribute to insecurity and inequality, and how policy reform and accountability mechanisms can strengthen community well-being. He brings deep expertise on governance and risk across diverse political contexts, and he is also the director of the Canada and the Asia-Pacific Policy Project, where we just had a health and human security conference last month. Over to you, Rob. Thank you.
Thank you very much, Athena, and for organizing, and thank you so much to my panelists. Today, as mentioned, I'm coming from Thompson Rivers University, which is on the traditional and unceded territory of the Kamloops Secwepemc people in a city called Kamloops, British Columbia. So we're about 3.5 hours from Vancouver, if you're not sure where that is. Today, I'm going to I will acknowledge I'm a little bit outside of my area on the health security and front, but I have been writing about human security for many years, and in the space of also something also called non-traditional security and threats and how that works. I got into this work years ago through human rights work, specifically on institutions and anti-corruption themes that Athena mentioned when I worked for a group called the Asian Human Rights Commission in Hong Kong. And one of the things that kind of was very eye-opening to me during those years was just the interconnectedness of people's well-being. When the state fails, you not only had institutions failing, but you had issues with food security, you had health consequences, educational situation. So it was a real mix. And I just wanted to kind of begin by acknowledging kind of the disaster that our friends and colleagues in Sri Lanka and South Asia and Southeast Asia are going through right now after the deadly cyclone. And my colleagues there are reporting that the damage is actually worse than the 2004 tsunami at this time. The death toll is still lower, substantially lower, but the damage and the cost is expected to be dramatically high. And if you think of the context of, the interconnectedness of that emergency and that disaster and what that is going to do for food security on the island and with also what it means for resilience in that context. And you can see the geopolitics at play immediately. And so this is part of what I'm going to be talking about. As soon as the disaster happened, China announced $100,000 US in aid. The Americans then came out and announced 2 million in aid. China then upped their aid to 2.5 million total. Australia and New Zealand's committed 1 million each. Still waiting to hear from Canada. I don't know. I think we had a nice Facebook message. It puts things into context. But I want to think about, and I'm very grateful for Rosalind and Andy's kind of overview of human security. And I'm just kind of, again, jump into kind of some of the themes that I'm thinking about when we think about human security. And if you had watched the news, and I know I'm on a call with many smart people and people that are smarter than me, and if you see the news, this is just a typical day in the news at BBC from yesterday, and every single story on this page, again, the main page, touches on some type of insecurity. And we're in a space that, again, what I'm very concerned about is how we process this insecurity. And we're again, in the context of geopolitics and competition and rivalry, we're seeing, different responses from different great powers, from middle powers, and so on. And I'll try to put this in the context of health, security, competition. But the idea of living in an age of human security or insecurity, and you can think again, Rosalind and Andy covered a lot of this, but there's some themes that we can take away, kind of this idea of political realism, the idea that it's a world of nation states, great powers, and what that does for the rest of us. And as we try to kind of adapt between competition, how do we respond? And we're seeing institutions failing. We're seeing trust levels, which have been talked about significantly today. The increase of the poly crisis, or at a time when I was doing my undergrad, we called them kind of complex emergencies. But this idea of these interconnected crises, and it's creating this atmosphere, what Giddens refers to as kind of the ontological security and existential anxiety, the mental health concern, the idea that you can see health insecurity and food insecurity on your cell phones, in your pocket, quicker than I can, explain it to you, that we're in constant 24-hour stress because of this. And often when we put this in the context of why this is happening, we look at it from a kind of we can look at it from a state perspective or a non-state perspective. But in the end, we measure, especially in my field, where we measure kind of how the state or governments are doing. And, the idea, again, which, speaking back to my days in the human rights field, is, the state was the principal violator of human rights, and it remains, and it can, in some ways, be done human rights violations by, carrying out of violations, such as, arbitrary detention or kind of these things. But it can also be done by not doing something. And here we're seeing capacity, state capacity, and often the idea of states not being able to respond or not wanting to respond. And so again, my research and area kind of looks at this area. Now, the freedom from fear, freedom from want framework that Rosalind talked about in the UN kind of, UNDP kind of 1994 guidelines that introduced human security and tried to mainstream it, right? It talked about these freedoms. Here you have an image. These are uniquely kind of Americana images that speak to kind of the freedom from want, freedom from fear. You have the father tucking in the children, trying to protect them. The newspaper says London bombing. The side on the right is kind of the family around the table, eating well fed. And these are Norman Rockwell paintings that were commissioned during World War II by the US government to try to make the connection of what was happening on one side of the world would eventually show up on your doorfront. And so the two freedoms, or actually it was four freedoms that the U.S. was advocating: freedom from fear, freedom from want, freedom of speech, and freedom of religion. Right? These were kind of mainstreamed in trying to get people to think of the world outside their own kind of families and outside their neighborhoods, and especially outside their country. If you fast forward to 2022, the UNDP launched another document called the Human Security in the Anthropocene, and they talked about freedom from fear, freedom from want, but they extended it into anxiety and freedom of dignity. These themes that, again, the recognition that anxiety has when the state can't respond. And when you think about health, it's something extremely personal to us. It impacts all of us, even if you're someone that rarely think, you might have a family member impacted. And it's also there was a question raised earlier on the people-centered approach versus the cost, right? We're talking about $1 trillion industry that largely is involved in this space. So it's it brings in lots of different themes, feelings of anxiety, and it directly impacts how our human dignity is connected. And you can just think of the failure kind of around the global response to COVID. We talked about the importance of human security diplomacy, which is absolutely correct. But then we also have human security diplomacy failures. And COVID, when you think of what that did for trust levels on themes of multilateralism, themes of, do we have faith in our institutions and our governments? It was, extremely problematic. Even today, when we say, again, I'll move to China just in a few minutes here, but we still have this bigger question, of what happened during COVID. And even the WHO's report that released this summer still says they don't have all the information on, the full stories of COVID and the cause. There's multiple scenarios and theories, but we're still not sure. And that, again, brings big questions on governance. It brings big questions on the capacity of institutions to even investigate and surveil the outcomes of these kind of pandemics. You can think of the shuttering of USAID. Every news around the world has created dramatic health implications. And of course, we can think of poverty gaps, and we can think of generative AI as another kind of existential anxiety that's kind of driving us. And again, the UNDP acknowledges this in the context of our mental health again. And so the question is China filling this gap? When we see trust in institutions waning, we see, these constant threats on our phone that you can't escape. And we see kind of the world's largest donor and contributor, and in fact, leader in the space, pulling back. What does this mean for China, and how can we think about it moving in the future? And the big question I ask in human security and in politics often, again, my background, is this, is the new multilateralism or the new, multiplex world, as Andy and I think you were referring to, Amitav at American University talks about, this dominant, is China going to dominate this space too? Are we seeing really kind of a change in world order, and how is it going to impact the global health space? This is the cover of The Economist magazine just from this week, and it's again, you pick any newspaper in the world, any city, any language, you're going to have a story on China somewhere in there. Universities, our students around the world are having these exact conversations right now. Are we seeing a shift in power? And why are we seeing this? Where did it come from? And what does it mean as we move forward? And so I'll talk a little bit about just kind of how we got here and China's kind of evolving political identity. We see, there's a long history. I'm not going to go into this history. Don't worry. This is recorded and you can Google this stuff later, right? Again, you can probably research it quicker than I can explain it. But the point is that China's history has been one marked by a colonial past, a civil war, an ongoing civil war, we could say and still say in the constant unresolved with Taiwan and China. And at one point, if you think of the colonial implications that were, kind of impacting China, the cities that were controlled by foreign powers. At one point, Mexico had control of a region of China. So, we have this country that has gone through violence and occupation that has shaped its political identity today, and one that is constantly reminded to not only its people internally, but it's also externally, right? So the internal and external message of China's modernization comes into play here. And Xi Jinping introduced something called the China Dream in 2012, which you may have heard of. And this was meant to make China great again. And it was meant to kind of articulate the trauma the country's gone from and the idea that it's now rising up. It's China's time. And how is it going to do this? And in this sense, of course, a rising power causes a lot of problems for a lot of people at the top. And so we get new language emerging in the human security and non-traditional security space around multipolarity, again, decoupling, techno-nationalism. Pick your newspaper, pick your section, and you're going to hear these terms. But in the end, regardless of all this political kind of narratives, China has essentially, developed on all of the indicators. You look at the health indicators, China is improving. Life expectancy is getting much longer. It's again, here's a headline: Xi declaring ending to extreme poverty. And if you take the Human Development Index and you put it up against how China's doing, it's skewing global numbers, and it has been for the last 2 decades. That the rising numbers of people out of poverty, increased life expectancy, and so on. So, how do we think about this in a kind of non-political framing? And that is my most kind of stuff that I write on in the human security and NTS space. And, the story begins as one about competition. And here again, I won't go into these moments. You can search them later. But China kind of seizing this opportunity to kind of go global. China going out. And in the end, China, when it think of how it's going to kind of depend on global markets and commodities, China's driven into a lot of conflict-related zones. It has to go to the places that are most problematic because Western countries have been there for decades and decades already. So you start to see China kind of sending out its state-owned enterprises, its state-led enterprises, but it's realizing there's a world of competition. There's a lot of distrust in how the Chinese firms are operating, but there's interest because if China can't deliver its, energy, if it can't deliver its food security, you have a political legitimacy crisis at home. So its ability to justify its own governance, it has to deliver. And interestingly, this is, if you see this here, this is the Edelman Trust Barometer. I know what you might say about, kind of any kind of matrix like this run by a PR company, but this is a, very kind of helpful tool. When you think of this irony that the world doesn't trust China, perhaps in some contexts, but if you look in internal trust, And here you have authoritarian government model that's highly trusted by its own public. And if you look at the democracies at the bottom, well, not trusted at all. So you have this very interesting kind of trust gap that's happening in this space. Now, what has China done to try to kind of mobilize itself in this world of competition? And one of the things it's done is its Belt and Road Initiative. You might have heard about it. Again, this is what it is. It almost kind of, if you haven't heard about it, your kids will have heard about it. It's going to be generational, transformative. That it is again these kind of $1 trillion effort to bring China to the world. It has to export its goods. It has to trade. This is its regime legitimacy on ensuring its own survival. It has to engage the world. It doesn't have a choice. And multilateral institutions have been very important for China's success up until this point. But it also doesn't just kind of have a Belt and Road Initiative, again, that might begin defining kind of trade and geopolitics in our era. It also has its health Silk Road. And health becomes a part of its, also part of this identity. And again, I'll give you some information just in a bit. But what I would argue is health is still very small, kind of on the scale of what China is doing, even though China is creating a lot of narratives in different places that are very important, high level meetings. It's still very small comparatively on its kind of influence and the scale of, again, other countries donating or the EU, for example. Here's just a map again. You can think of the very small blue there in the middle is kind of China's volume of health kind of engagement in the world. But what's it doing? So consider this, right? So these are just some examples of what China's been doing in this kind of Xi Jinping order on the China Dream front, right? We know that China was one of the first countries to engage and kind of mobilize its government to combat the Ebola outbreak in Africa. And this is tied very much to China's interests in Africa again. And this speaks to, again, China having to go into places and do investments that the West is not going into. So China has very strong political interest in these places. So again, make this example in West Africa unique was that China mobilized 23 agencies of its own agencies, its military, its health authorities, its foreign affairs office, its banks, these mobilization kind of putting China out there into the world because it realizes that its health narrative and its ability to respond to its partners is also very much again dependent on China's ability to engage with its own people and its own legitimacy. We see the health Silk Road taking different approaches. We see the Chinese traditional medicine. There's 14 BRI countries now engaged with 30 centers for traditional Chinese medicine. Again, some points here. I know we have quick on time, so I'm going to just kind of leave these examples here. But a couple of things in the ideational space. We see China's Global Security Initiative 2023, and this is part of a larger program that China is doing and trying to create its foreign policy in the new era. It's the four kind of global governance approaches that China is doing to try to create, I would argue, parallel institutions to the West. I don't know necessarily they are competing with trying to undermine the West. Some would say they are. It depends on what seat you're sitting in. But they certainly have lost a lot of trust in Western institutions. They are certainly speaking to Andy's point and positioning themselves and bringing in the global South to the table. They are trying to kind of demonstrate themselves as this leader. And so we've got again the China's Global Security Initiative here. We've got the Kazan Declaration, which was signed with the BRICS countries, but it still has these big challenges. Again, political instability, globalization and transnationalism, trust problems, competition in innovation. But we do have a very clear white paper, again, very clear kind of here gets example from the State Council of Information that China is committed to the global South and continuing to kind of try to position itself as a leader in this area through the Belt and Road, through its Health 2030 agenda, and so on. But can it lead? And here is just some of the big questions. Again, stability and development are the biggest challenges to China's. point. Again, it still has huge, significant poverty gaps internally. It has environmental challenges and climate change challenges, and it has capacity problems. It has an overcapacity problem. It needs its Belt and Road Initiative to actually export its stuff. So tying its health security and leadership to kind of its development model is very much strategic. The risk of politicized narratives, we see populism and decoupling. Again, we see this kind of geopolitical space. The four global initiatives here are these parallel initiatives that, again, President Xi Jinping has released, and they all speak to health on some level, especially the global governance, or sorry, the global security initiative, which has tied health education. It has tied training as well, and so on. So, norm entrepreneurism, is China trying to change the narrative? Today, it's the second largest provider of the UN budget. It's the second largest contributor to the Department of Peacekeeping Operations. You get a similar scenario at the World Health Organization. One of the things that we proposed in our work, these are two books, shameless self-promotion of some writing, but the importance of shifting this to a human security narrative around resilience, the idea of taking a people-to-people connection, of trying to kind of push back against geopolitical rivalry, that we can't lose sight that health and human security, that this is about the people on the ground. And again, I'm happy to speak to examples of this, but it's worth engaging in peace building and conflict resolution to try to figure this out. And what I see, again, China is still kind of, again, still not necessarily, I wouldn't say leading. It's leading the narrative, but it's not necessarily leading the cause. So some concluding thoughts here, and then there's some questions. But China's influence on the global health regime is certainly impactful, certainly increasing. It is seemingly filling a void where the U.S. is pulling back, but it's more language. I would say it's not transformative yet. You still, but it's showing up, and it's talking about this stuff, and so that sends quite a bit. The health and aid trajectory, they're often tied to wider development objectives and security objectives. So health security is, as Sarah mentioned, tied to the regime legitimacy. It's tied to its Belt and Road Initiative. Health is fundamentally part of what China can go out and justify. There's a story even today of a mine I believe it was don't quote me. I want to say Tanzania, but I might risk, but the tailings pond exploded. And you have now this big health problem around the drinking water. And so this, you have development and mining extraction, but you have to have a health narrative and environmental discussion going on at the same time. That China can't, it has to bring this all in with it. And again, the consideration of the China's international development cooperation in the new era, an official document, significant document, and that document mentions health security 53 times in its kind of global plan of development cooperation. So we're seeing China push into new spaces, but the politics of health security are still there, and rivalry still there. So again, I think human security is a good framework for trying to depoliticize some of this tension. So I will leave it there. Thank you.
Thank you, Rob. Very thoughtful comments when we look at expanding the notions of who the key actors are in the space, and recognizing that, Andy, you've mentioned the need for shifting power dynamics and the ability to accommodate new threats, and looking at how, Sarah, looking at how I mentioned something that sticks out in my mind in your slides is that 8 out of the top 10 countries with the most disaster-prone contexts tend to be coming out of South Asia. I'm just monitoring the chat box. We don't actually have any questions specific to any presentations right now, or to Rob's presentation right now. So I'd like to open it up to the panel at large. And perhaps we've got 10 minutes left in this panel session. So perhaps over to you for some closing thoughts. Perhaps Andy, then Sarah, and then back to you, Rob, while we see what peppers the audience is thinking.
Thank you very much. That was a very good presentation, Rob, and also Sarah. Thank you very much for your input as well. I particularly like Sarah, your notion of syndemic insecurity, because that captures in large part not just a concatenated nature of insecurity, because it's more than just simply linking up all of these different types of insecurity elements, but it also deals with the structural complexity of that kind of connection, which I think is very important for what we're doing as well. And I would like to steal your term. I use it in our book as well because the full credit to you, because I think this is a very important concept to use. And it really explains a lot about what we were trying to do in the book as well, the volume. But I think this has been overall a very good presentation. I learned a lot from listening to my colleagues here today. So Athena, thanks very much for making this happen. And I look forward to continuing this conversation. I hope you're able to do something with it in terms of a publication too at the end of the day, because I think this is something that we need to expose our students to. I know, for example, in one of my classes on global security this semester, we've been working on these different types of security issues, and just simply to emphasize to them that the concept of security has expanded way beyond what we traditionally thought it was, which is, the protection of the state. I mean, we've gone beyond that now, recognizing that the state sometimes is responsible for insecurity of its own people, as Robert pointed out. So I think we need to be able to just remind students of the complex interdependent nature of security now, and the need to sort of broaden the parameters of what is considered to be security, who is being secured, and how they're being secured and why they're being secured. I think that's a very important contribution that's being made in this presentation. So thank you very much for having us.
Thank you. Sarah, do you have any closing thoughts or resuming thoughts? And then we do have a question also from Rob.
All right, let's take question one and then I can.
Okay. Question from Radhika. Thank you. Question for Rob. How has money and lending from China, for example, to nations like Kenya, Pakistan, and Sri Lanka, changed their bargaining power when they negotiate with countries like the US and Europe, and with institutions like the IMF? Thank you, Radhika. Over to you, Rob.
Hi, Radhika. I think you know the answer to that question, but I will. Radhika's also at Thompson Rivers University. What I'd say is, that we're in a funding is a tricky thing, but you get very different domestic narratives happening in the context of political elites versus people on the ground. And you get different narratives in different business circles. You get different narratives in universities. We like to think of China as this monolith that we can kind of say, well, this is how this is happening and this is how it's going. But I just say it's much more politically divisive and controversial. And one of the things, if you show up with a bunch of money and say we're here to invest, you're gonna imagine just even you imagine you win the lottery and you go home and tell your family, and I won the lottery. You're gonna have your whole family yelling at you with different ideas on what to do with it, and some probably pretty upset on what you decide to do with it. And we're kind of in this very strange space that China does its economic diplomacy tied to conditions. There's three types of diplomacy that it has. It has, unconditional aid grants. It has tied commitments, and then it has these other ones that are tied to kind of low interest loans. So it is disrupting the narrative. Definitely. We're seeing, some responses with, again, the United States trying to create its own infrastructure investment bank. You see, Western country, European Union also kind of trying to push back on this. You see narratives emerge, new paradigms like the Indo-Pacific narrative. The Indo-Pacific is an attempt to push back on this as well, right? So, we're not quite using the language of the West trying to contain China, but they're certainly behaving in a lot of different ways. But it does absolutely create disruption in these economies. And from the human security approach, I think again, we have to kind of just look at the people on the ground. And we spend a lot of time looking at the higher level stuff, but you can look at initiatives that are happening, especially some of the within communities, but also within international organizations. Some things that just come to mind, if you think of like the Better Factories program in Cambodia and expanded to other places, they had tremendous health and safety th trainings attached to that. And those were kind of very small micro examples, but they often focused on train the trainer, low cost initiatives of capacity building at the micro level. I think that question around funding, it's a big question that you're going to get a lot of different opinions on. But in the end, we can't lose our kind of focus on how we're trying to make life better for people in these countries.
Thanks, Rob. We have one question also from Keith, the CUGH Executive Director. One question that's also been echoed by Radhika. How will nations meet growing public needs in the midst of the current debt crisis globally? I think you've partially answered that, but if you'd like to have a brief moment explaining some more thoughts on that, I would also like to take a few minutes for Sarah to have some comments, and then I'm not sure if Keith is available to take some audio for the call, but given that he's also the ED, wanting to ensure that we've got time to cover fulsome comments and promotion for the conference upcoming next year. And then following this, I think we'll be at time for close. But it's a great poignant question. Over to you, Rob. Thank you.
Well, I think we just need a radical kind of rethink of what's happening. I mean, again, if you look at the trust levels on the barometers, there's low trust in most Western democracies, their governments right now. And we like to think of, oh, our economy is the worst, but all of these economies are going through crisis. And we haven't recovered from the COVID kind of economic, the post-COVID economic situation. It's going to take political leadership to acknowledge this. And so one of the things we write in one of our books, my colleague Ken Christie and I at Royal Roads University, we talk about kind of elite responsibility that, and I can, again, pick up the Wall Street Journal today or anything and just look at the profits going into banks. I just saw one today, a $2 billion profit in a Canadian bank in a quarter. And so there's serious imbalances happening. I'm not saying that it has to be anti-capitalist, but there needs to be an honest conversation about equity, and health being the most important thing here. You can't get ahead in life without your health, whether it's and so thinking of that as just a baseline, and how we can kind of think about the importance of the interconnectivity of that. But it's definitely going to be needing leadership here, to kind of have a serious conversation.
Thank you. And I feel like I would like to vote for you in, in not 2026 in Canada, but whenever, not 2029. Sarah, thank you, Rob, for those insightful thoughts, and also shamelessly promoting your book, and Angie and Roz, your book. But these are also really fruitful ways of reconsidering and reconceptualizing our relationship to health systems, our parts as health actors, and how we want to create better infrastructure or more comprehensive infrastructure in these growing global para-crises. Sarah, any concluding thoughts? And then I'm not sure if Elizabeth, if we've got some time to pass the baton back to CUGH. Thank you.
I just want to thank everyone. Thank you, Andy, for your kind words. And Andy's, I'm looking forward to read your book. And Rob is also edited a book. I'm looking forward to read that. And in this environment, in this international system where we do see more of populism and we do see nationalism and more of this traditional security is being taking more prominent role, and human security is being sidelined. We need events like this, and we need people like Andy and Rob to keep pushing for human security. Thank you.
Thank you, Sarah. And baton back to CUGH.
Athena, thank you very much. Keith Martin, I'm the executive director of CUGH. I'd really like to thank Professor Madan for her wonderful leadership, not only here, but also she co-led our education committee. So she did a wonderful job. And frankly, this is a really selfish thing because I'm from Victoria, and I feel like we've got the Victoria, Vancouver Island, BC mafia going on here, as all of you on this panel know, and so it's I really want to thank Athena for this, and Professor Knight, Professor Bannon, Professor Hanlon, thank you very much from all of us at CUGH for participating on this. As it personally, it's lovely to see Canadian presence on this panel and within CUGH. Although we're based here about I can say this, a kilometer north of the White House. Um, it is nice to and lovely to see all of you here because, frankly, one of our goals in this moment where, and you've all spoken about this really fraught time of insecurity, where forces seem to be tearing apart the very structures that were created post World War II to give us a better, freer, happier, more secure world. And to some degree, that happened, as you've all mentioned, but it's unraveling. And at CUGH, what we're doing and what we see is that we believe strongly that global health is a way to forge bridges of cooperation and partnership and collaboration to the things that unite us, to the things that bring a more peaceful, secure world for all, as all of you have mentioned in your wonderful presentations. So I just wanted to emphasize, and Professor Madden knows this, and all of you, and to all of those who are actually online, um, thank you very much to all of you for working with us in this effort. This session is not the end, it's the end of the beginning as we continue to work forward together in this effort, which will take time and effort, but we'll only do it with wonderful people like yourselves and those of us who've taken the time to be on this session. In closing, a couple more things. This session for all of you will be on CUGH's website in a couple of weeks. And please take it and share it widely, along with the other 15 sessions that are taking place this week. So if you have time, you can still sign up on cugh.org, cugh.org. Take a look at the other sessions and please join them because they're absolutely fabulous like this one. And make sure you do come to our conference, which is Washington, D.C., next April 9th to the 12th, and it'll be the future of global health. That's a shameless plug to be here next 9th to the 12th of April. I hope to see you there. We hope to see you there. And to all of you online, again, thank you for attending and thank you for working with us in this effort.